So it's the beginning of June, and in the course of a week, we went from isolating from a deadly virus to major protests and violent riots throughout the country. The news has shifted everyone's attention and focus to the riot. But is the pandemic winding down and fading away? Or is it just on the back burner? Where are we at with the pandemic? And that's the confusing part. How do you figure that out? Do you look at the response to it? Or do you look at the statistics? Because when I look at each of them, they don't match. To better understand where we are now, let's first go back in time and look at a couple other pandemics in history. The Black Plague hit Europe in the year 1346, and it was caused by a bacteria that was spread by fleas and rodents. It was said to wipe out half the population, between 50 million and 200 million people, and many of them were buried in mass graves. Can you imagine if half the population died from the coronavirus today? And then in 1918, the Spanish flu was the most severe pandemic in recent history. It's estimated about 50 million people died from this virus. And that was about a fourth of the population. So how are we doing today in comparison? And of course, today we have progress in sanitation, in science, in medicine. Today our population is 7.8 billion. And the amount of deaths from the coronavirus is close to 400,000, or less than 500,000. That's a fraction of a percent. So the numbers are very low. And that's even with the hospitals and medical doctors reporting that they are given incentives to put COVID on the death certificate.
But ER doctors now, my friends that I talk to say, it's interesting, when I'm writing up my death report, I'm being pressured to add COVID. Why is that?
In cases where a definite diagnosis of COVID cannot be made, but is suspected or likely, like the circumstances are compelling with a reasonable degree of certainty, it is acceptable to report COVID-19 on a death certificate as probable or presumed.
If someone dies with COVID-19, we are counting that as a COVID-19 death.
I've talked with doctors who have admitted that they are being incentivized to list patients that are sick or have died with COVID-19.
Yeah, $13,000 for Medicare, if you call it COVID-19.
Right now, Medicare has determined that if you have a COVID-19 admission to the hospital, you'll get paid $13,000. If that COVID-19 patient goes on a ventilator, you get $39,000, 3 times as much.
And what's interesting to me too is when someone dies in this country right now, they're not talking about the high blood pressure, the diabetes, the stroke. They say, did they die from COVID?
And then this article recently came out. German official leaks report denouncing corona as a global false alarm. And he goes on to say that the dangerousness was overestimated. Probably at no point did the danger posed by the new virus go beyond the normal level. And the people who died from corona are essentially those who would statistically die this year because they've reached the end of their lives. Here, worldwide, within a quarter, there has been no more than 250,000 deaths from COVID, compared to 1.5 million during the influenza wave of 2017-18. He goes on to say, during the corona crisis, the state has proved itself as one of the biggest producers of fake news. And those are very strong words. So the total number of deaths are very low, despite the incentive for medical doctors to exaggerate. And according to this last report, the number of deaths are the same as any other year and what we would expect from the flu. They also show the recovery rate to be 98 to 99%. So we know a lot more than we did a few months ago. We know how contagious it is and who is most affected. And now that we understand it wasn't as bad as anticipated, it seems like we can relax now. And let's get back to life. But that's not what's happening. Even though the statistics show it's not a severe pandemic, the response would make you think we're reliving the Black Plague. Still, there are new rules that are becoming more and more strict. Besides the standing 6 feet apart and direction arrows in aisles of the retail stores, now we have in Los Angeles, face mask rule now requires face coverings every time you leave your house. And here's some new rules for Irvine. This was effective May 19th. For face coverings, requires all personnel and patrons to wear face coverings and follow social distancing. Violation or failure to comply with this order is a crime. Civil penalties up to $500 per violation per day, and may result in closure of business. And then if you go to the beach, you can't just sit there. You have to keep moving. It's open for active recreation only. You can't just sit around and sunbathe. Are you sure this makes sense? And secondly, there are some new CDC guidelines for when the kids go back to school. And this was updated on May 19th, long after the statistics show that the coronavirus is not that deadly. I'll have a link back to the full article at the bottom of the page. And again, these are just recommendations, but it's still planting the seeds on how the schools will start aiming to change. Kids over 2 years old should wear a mask. I guess if you're under 3, then that's too young. Secondly, there's no sharing of items, and that includes electronic toys or any learning aids, pencils. 3, distance on school buses. So they want 1 child per seat, and then you skip rows. No field trips or assemblies. And there's much, much more. And again, these are just a few. You can see the entire list of recommendations on the CDC website. But in summary, the new normal for children will be to live in a state of fear of getting the cooties, aka the coronavirus, that has a 98 to 99% recovery rate without treatment. Another thing to note, there have been thousands of criminals released from the jail or prison. And don't get me wrong, it's nice that they're worried about the prisoners' well-being. Let's take a look at the website here that has a summary of all the info. This is the Prison Policy Initiative, Responses to the COVID-19 Pandemic. Prisons and jails are amplifiers of infectious diseases such as the coronavirus, because social distancing is impossible inside and movement in and out of facilities is common. So just to take a look at a few of these places, here's some jails. Miami-Dade County jails in Florida, the jail population has reportedly dropped from about 4,000 people before the pandemic to about 3,200. That's 800 people released out of that jail. Over the course of a month, the jail population in Hennepin County, Minnesota dropped by 44%. Alabama has released about 16% of their jail population, 107 people, since March 16th. Approximately 1,000 people were released from the jails in Dallas County, Texas, to help reduce the risk of transmission. Now, these are the jails. Let's look at the prisons. Connecticut let 560 prisoners go. In Michigan, the number of people being paroled from a state prison has reportedly increased by about 1,000 people. But you get the picture, and hopefully now for those that are still in jail, there's room to social distance appropriately and stay that 6 feet apart. And since they're high risk, hopefully they're at home and safe during all the craziness this past week and didn't get involved in all the riots. Another thing, would this be a real pandemic if we didn't have a money-making vaccine coming along the pipelines in order to save us? Bill Gates has become the mainstream media expert for pandemics and vaccines.
And how you get a vaccine that making 7 billion of those is going to be an incredible challenge. Because until we get almost everybody vaccinated globally, we still won't be fully back to normal.
But we aren't going to have any vaccines for probably a year. So I can't even imagine going out to a crowded restaurant or anything in June or July if we don't have vaccines.
Eventually, what we'll have to have is certificates of who's a recovered person, who's a vaccinated person, because you don't want people moving around the world where you'll have some countries that won't have it under control, sadly.
So there are vaccines coming in the pipeline. He wants to vaccinate the entire world, and soon you'll need a vaccine certificate to show you've been properly vaccinated. Again, all for a virus with a 98 to 99% recovery rate. And the final thing I want to share is about contact tracing. What is contact tracing? Well, that's where they keep track of who you were in contact with during the regular day. And then if someone you were in contact with tests positive, then they're going to let you know. But first of all, I want to show you that the world's getting set up for contact tracing. Here you can see there's a bill introduced to Congress. It's H.R. 6666, COVID-19 Testing, Reaching, and Contacting Everyone, the TRACE Act. So if you want to read that, I'll have the link. And also I want to point out that the technology is here as well. iOS 13.5 is here to make your iPhone COVID-19 contact tracing ready. So Apple and Google combine their efforts. Now your iPhone will be able to open much more quickly if you're wearing a mask. Wow, that's amazing. If you scroll down on the page, they have an explanation on how exactly it's going to work. I'll talk about that in a few minutes. And then also, you should know they're hiring temporary contact tracers now. This is down in San Diego, $19.50 an hour. Although this one is already filled up. But just to let you know, the world is preparing for contact tracing. And so what is contact tracing exactly? That's where they're going to keep track of where you are and who you were in contact with during your regular day. Then if someone that you came in contact with tests positive, you'll be notified and you're going to have to quarantine for 14 days. But no worries, they're going to buy groceries for you, and if you need help, they'll find a place for your kids to stay. This is all for a virus that is not more deadly than the flu. So the next question most people ask is, well, is it mandatory? Well, kind of. This next part I'm going to show you is from a lady who took the training to be a contact tracer. She took 9 hours of training and has 2 certificates. And here she explains what happens if you don't comply to this voluntary request.
Now, you've been hearing, and basically you can read this, request for voluntary quarantine. This is for somebody you're the legal guardian at. It tells you to go and remain at the address by the date and time. And then I love this. It is very important that you comply with this request for voluntary quarantine. Remember, I'm not sick. Nobody's sick. Your health and the health of others depend on it. If you do not comply with this request for voluntary quarantine, we may use a detention order enforced by the police to assure your compliance. That's the strangest voluntary request I've ever received. And then this is also on the website. But you can see here, if you use a court order because someone is not following, they have non-compliance, you can be incarcerated and fined up to $2,000 per day.
It's voluntary, but if you don't comply, it can be enforced by the police and you can be fined. Well, isn't everything voluntary then? The world is ready for a deadly pandemic. We have a bill in Congress, technology is ready, contact tracers have been hired and trained. There's new and more strict rules for our safety, new rules for kids at school, prisoners have been released, vaccines on the way, and contact tracers to take care of all our family's needs. All for a virus that is more deadly than the flu. The only thing we don't have is a deadly pandemic. And why is this happening? Why is the response so strong when the statistics don't support the need? Maybe they didn't get the memo? Maybe they want us to be in fear. Maybe they have an agenda that is different than putting the well-being of the people first. You decide.